Good evening. So I've got a question. How many of you have experienced that unexplainable moving feeling that overcomes your whole body while listening to music? My prediction is that almost everybody in the room has. Well, my goal for today is to try to explain what is going on there and why it has so many benefits to our well-being. Everybody in this room has a love for music in one way or the other. So unless you've researched this topic before, I believe everybody will learn something new today. Like many of us, I too have experienced these unexplainable feelings while listening to music, and I've always been intrigued by them. Luckily, I'm not new to this topic due to its appearance in some of my psychology classes and other studies that I've further put upon myself. So, the use of music therapy can be used in many forms, but mainly it's used to reduce physical, emotional, and mental pain. Although many folks will react differently to music, this therapeutic technique is not just a theory and can be backed by scientific evidence. So, before I get into the science of it all, let's ask the question, what is music therapy? Well, according to the American Music Therapy Association, music therapy is the clinical and evidence-based use of music interventions to accomplish individualized goals by a credentialed professional. So, essentially, music is not just something that might make you feel better, but it is scientifically proven and utilized through science to benefit the human mind. Now, let's take a step back for a moment and let's look at what music is. At its core, music is sound, which is created by vibrations. And it may seem unlikely that something as simple as a vibration might be able to influence your human mind, but in fact, it is capable of doing such. So there are two types of use for music therapy. There are active techniques, which consist of participating in the creation of music, which can assist in articulating difficult feelings and act as a springboard for emotional awareness. This technique is heavily utilized to treat symptoms of depression. The other is called receptive techniques, which utilize pre-composed music to help maintain relaxation, reflection, and sporadic change in mood state. This technique is used widely for anxiety. Now, I'm sure that you're thinking, well, why do these techniques work? Or possibly, how can I use them myself? Well, let's look at what music can do to the brain. So, music can affect parts of the mind, such as the anterior cingulate cortex. Now, what that is a part of the brain that determines emotion and reward-based learning. So, music can be highly motivational and stimulate clients to diminish negative and self-stimulatory responses, therefore increase participation in a more social appropriate way. So, also, another form of the mind that it can affect would be the prefrontal cortex. The prefrontal cortex determines your cognitive skills. And by that, I'm referring to maintaining attention, organizing information for memorization, and a way to utilize this could be listening to calming music when you're trying to focus on work, or possibly creating little tunes in your head to remember a vocabulary list or a specific list of terms or such. So, and another interesting thing to note is that the way that it affects your mind is different for anybody. And not only can it affect parts of the mind like this, but it can also stimulate or stabilize disorientation in the mind. So, like I said before, an active, which would be listening to music, way of using. Okay, so using music to stabilize disorientation, which essentially is memory loss in the mind, would be use of listening to vibrations, which would be an active form of listening. And what this can do and has been proven to do is improve memorization through Alzheimer's patients. And it's a very interesting thing to wrap your mind around. It's kind of difficult, but essentially these are all ways that music has been much more beneficial than just making you feel better. There are much deeper ways that music can affect the mind, and there are much deeper ways that music can affect your whole body and your state of well-being. So let's go over all this information. So I've reviewed what conditions music can be utilized for. I've explained the different techniques used within music therapy, and I've explained why and how these techniques can be utilized for certain issues. So one of the major misconceptions about music therapy is that it's just a theory and it's just a coincidence. Well, I hope that my points are able to show you that music can reduce physical, emotional, and mental pain. And although many folks will react differently to music, this therapeutic technique has just as much potential for healing as any other form of therapy. And it should be taken seriously and not viewed as a theory. Now, to sum this up, I was hoping to shed light on not only music therapy, but even therapy and music separately. So maybe if you feel like you need more music in your life, or you feel like you want to do therapy, or you're not sure, and you love music, but you don't want to be in a session, I encourage you to look into music therapy. Because although it's combining something you really enjoy with something you might not enjoy, you'll find that if you're looking for a way to heal, this could be the best way to do it. And if you're having any misconceptions, just look at the evidence. So, thank you for your time.